Dr. Habiba Aziz, and I'm a student at California Institute of Research and Technology. Today, I will be presenting a very unique, rare case of a 6-year-old Asian boy with X-linked adrenoleukodystrophy, also known as adrenomyeloneuropathy, Children's disease, encephalitis periaxialis diffusa. Adrenoleukodystrophy is the most common peroxisomal metabolic disorder which is caused by mutations in the ABCD1 gene that encodes the peroxisomal membrane protein ALDP, which is involved in the transmembrane transport of very long chain fatty acids. Therefore, a defect in ALDP actually results in increased levels of very long chain fatty acids in the plasma and tissues, including the white matter of brain, the spinal cord, and adrenal cortex. Although this disease manifests usually in males of age 5 to 12 years, but also 35% of adult males are affected. Between 20 to 50% of female carriers, females have at least some symptoms in their lifetime. So in this unique case, as you can see my poster, the patient with a positive family history of ALD in the family, his maternal uncle and brother presented with multiple symptoms like sudden onset of squinting of eyes, change in behavior, sleep pattern, otherwise healthy normal boy. He was taken to the ophthalmologist first time and then referred to a neurologist who later recommended doing an MRI to rule out ALD, which showed characteristic extensive changes in the white matter of parieto-occipital region. During all this time period, patient's family was so upset and heartbroken after hearing the final diagnosis of ALD, again in their family, affecting second male child. They did all the basic lab work, scans, as well as they did the symptomatic treatment for temporary relief, but did not want to go any further with the advanced stem cell transplant, knowing the consequences, cost of procedure, and the risk associated with it. As with this disease, there is no chance of survival and mortality rate is very high within the first few years of life. Only early diagnosis and symptomatic treatment can halt the progression of this disease. The patient was bedridden within 6 months period and developed seizures, weight loss, and poor appetite. Electrolyte imbalances were the highlight of this disease. Parents were counseled and offered anti-epileptic medications, but were denied due to the potential side effects related to the medicine. Patient ended up in the ER where due to continuous drop in his oxygen saturation could not survive and in the end unfortunately passed away. So the message to everybody is the prognosis is very poor with the most forms of ALD, as in my case. Severe disabilities and death are expected on the majority of patients with X-linked ALD. I would like to talk about a little bit about the treatment, the current treatment options, which are symptomatic and supportive, like hematopoietic stem cells transplant to halt the progression of cerebral ALD, or we can offer anti-epileptic for seizures. Then we can offer physical therapy, corticosteroids for adrenal insufficiency. As in this patient particularly, there was darkening of the skin and also darkening of the mucosa. There was darkening of the skin all over his body. And then also we can do dietary therapy, very long chain fatty acid restriction. And also this was suggested that the use of levostatin and simvastatins have a beneficial effect when given at an early age. So here I conclude my poster that the early and accurate diagnosis of and treatment of X-linked ALD patients can actually delay the degenerative changes and its complications. If we do ABCD1 mutation analysis on a fresh chorionic villus sample at 11 to 13 weeks of gestation, or in some countries, pre-implantation genetic diagnosis is also available. Genetic counseling and prenatal screening by measuring very long chain fatty acids level in the blood can actually detect X-linked at early stages. If there is a genetic variant in your child, other family members can also have a DNA testing to see if they have X-linked ALD. This is highly recommended for extended family members. In the end, thank you so much, and I would like to thank California Institute of Research and Technology, Dr. Bernie my mentor, and team for giving me this opportunity to learn and explore and share my research topic and views, provide awareness about this rare disease and topic among everyone. Thank you so much.